Hello, this is Adrienne Payne-Andrews, and I'd like to welcome you to the Healthy Communities Initiative webinar, Framing the Message, How to Talk About Policy Change in Your Community. Today, Tami Bradley and Vera Bothner, managing partners with Bothner and Bradley, will talk about communicating strategically and effectively using a circle of change model that allows you to target your message while keeping the vision of your work in mind. On the line today are Sean Brown with Kansas Health Foundation, Vera Bothner and Tami Bradley, and Claudia Hohenbaum with Healthy Kids Challenge. Vera and Tami will begin with a discussion with the slide presentation and will allow time for questions throughout as well as at the end. During the last 30 minutes of the webinar from about 1 to 1:30, Claudia will introduce a resource and share some ideas for how the information can help actions around the community change framework. Just a few housekeeping items before we begin. As with previous webinars, all of your lines are muted. If you have not yet keyed in your audio pin, please do so now so that we can unmute you later. If you have a question, please type it into the box on the right side of your screen, and Sean will read the questions throughout and at the end of the presentation. Finally, we're recording the webinar, and we will archive it on SharePoint probably within the week. With that, I will turn it over to Sean.
Good morning, everyone, and thank you for joining us today for the webinar. We're delighted to have Vera Bothner and Tami Bradley with us again. Tami and Vera are no strangers to you, having been with us at the October convening, so I won't formally introduce them. I just want to say, Tami and Vera, I always learn something new no matter how many times you present, so it's always a pleasure to have you. And I especially look forward to what you'll be sharing regarding how to effectively frame the message. No pressure at all here. But with that, I will turn it over to Vera and Tami and let them pick back up where they left off after our last convening.
All right. Well, thank you, Sean.
Yeah, thank you so much, Sean. No pressure whatsoever. But and it's so hard because we so enjoyed the conference where we could actually see everybody face to face and really have conversations. So this is a little hard for us because we feel like we want to have the conversation. So let's all just pretend that we are having a conversation, and please do email any questions you have, and we'll just pretend like you just asked them of us rather than emailing. And then, Sean, thank you for reading any of those to us throughout.
This is Tami, and today we're going to be talking primarily about messages, as Sean said, framing the message, because we believe it's a critical strategy for engaging your community. Last month, Mary and Natasha talked about making the case for policy, and today we're going to talk about how we can communicate that policy in your community. Two sides of the same coin here, but we feel like there's a little different approach that we can take when we're actually taking policy to the community, and so that's what we're going to be focusing on today. Just to start us out here, why is communication important for public policy and the community change framework or model that the Foundation has introduced us all to? You know, it's all around the audience. The 3 bullet points here indicate that. It's audience-centered, it builds relationships, and it's action-oriented. This is integrated within the community change model throughout all those circles and all the arrows that represents. It's common sense in many ways, but what we're going to try to talk about today is how we make that a little more intentional in the work that we do on a day-to-day basis and that you're doing in your communities.
You know, it's really interesting. I've already spoken to someone this morning who, on that builds relationships, had a really tough meeting yesterday with someone that really disappointed them, and they just needed to talk it through with someone on how do you handle that, because they have an important, actually it's an important policy issue, minor in the scope of what they're dealing with, but it still interacts, and they just were disappointed. That continuing to build relationships is tough work, and we cannot ignore that. And the more you can do that, and the more you can keep your audience at the very center of what you're thinking about and doing, the more successful your communications and therefore your public policy will be.
So our agenda today, really, we have two things we want to cover, and we're going to focus most of our attention on framing the message. But we're also going to highlight a couple of tools that once you get your messages in the way you want them to be, and you've thought through some of that, you can integrate those into a couple of tools. These were picked because they're things we've been asked about, fact sheets and then social media. Social media could be an entire workshop in and of itself, so we'll just hit the highlights today, but we will talk through that. And we both want to just make the point that we realize that every community on this phone call is a little different, or they're very different. But in terms of your policies, where you are in the process, it is very individualized. What we'll be talking about today are general concepts. We'll be trying to offer some very specific ideas around policy issues, but we know that these can be and need to be adapted in your own communities. So we're giving you another framework, some things to think about, but we recognize that everybody is at a different place. So when it comes to framing your message, Natasha and Mary last month talked about these big messages. The first 3 bullet points you see on this slide is why policy. And that's where you get to talk about the vision that you have, your leadership team or the coalition has. Policy is important because it provides continuity and consistency across a community. It sets the environment for change. And again, these are sort of the big picture messages. How we talk about it in the community gets a little different. We're going to use this idea of a framework because it's been effective in other work that we've seen done and we've been involved in on a policy level. And really what a frame is looking at mental shortcuts. We all use frames. It doesn't matter what issue is thrown in front of us. We already have sort of our way. We're going to look at it based on who we are, what our experiences have been, and we're going to kind of throw that in a bucket, and that's where we're going to keep it until somebody convinces us or reinforces that thought process. I have to say that when I was trying to think through examples, I thought all I have to do is look at the front page paper, and the Affordable Care Act is a perfect example of how we all have had our own frames that we've heard that discussion, depending on what our political beliefs are, what we do for a living, what our own personal experiences have been. And it's hard for any of us to get out of that to really sort of look at what the other side sees or what else is being discussed as part of that conversation.
So we love using frames for the reason Tami just mentioned, and the way I sometimes talk about it is take any issue. I'm going to take nuclear energy. When I said nuclear energy, every one of you listening to this had an immediate mental picture in your head. Now, you may have some views that others share. You may have different views. You may feel ambivalent about it. You may not know a lot about it. But every one of you immediately had a mental picture. And that's what the frame is. Those are the buckets that Tami talked about. Because think how exhausting it would be if every morning we woke up thinking, what am I going to think about nuclear energy today? Which is why we develop these frames over time, right? So that's why it is really hard sometimes when people have really solid frames to get them to think about things in a different way.
We had a real-life example of this at the conference. I think you all might remember when Natasha and Mary had come into this from Minnesota, thinking that the word sustainability really was a safe word that explained a lot about the work and policy, and came head-on to a frame that a lot of people, particularly here in our community in Wichita, have, that sustainability means something completely different to them. And so as you'll see here, the why policy, they've actually adapted their language so that it's not sustainable, it's consistent in its continuity, which I think is really good. I mean, they really understood who they were talking to and who people working in this area were going to be working with, and adapted their message accordingly. So with that, when you're looking about how to talk to this and talk about your policy issues in the community, keeping your audience in mind is the key point. And your audiences fall into this, what we call a circle of influence, which is your which is on the screen right now. It's concentric circles. But you look at who is most important to carry this message, who's developing the message, and that's your senior leadership team. Then the next group of influencers in this conversation are going to be your coalition members. If you have a coalition, maybe you don't have that structure, but it's going to be a broader group in your community who will need to be talking about policy issues and understanding those. Then you go a little broader than that, and you have stakeholders. Those could be food producers, they could be bicycle enthusiasts, or any key group of people who have a stake in whether or not this gets, your policy gets passed.
Your hospitals, your folks who procure food, all of those could be the key stakeholders.
And then you have this broader community of leaders, community leaders, media, and I might say this is kind of where those campaign ideas reside. If you're thinking about a broad-based campaign that's at the outer layer of this circle, it's important, but it's important that you're building this grassroots effort as you're doing a broader campaign. And messages have to be developed at each layer that makes sense to that target audience based on what they need to know.
And with this particular visual in mind, think about how you talk about this at your senior leadership team, and then how you talk about this at your coalition. What often happens, and what we often find ourselves doing, myself oh so often included, and then I have to kind of snap myself out of it, is we use our language and our frames because we tend to be a little bit more alike. If all of you feel the same way and have the same frame about something, then we talk in that language to each other. And then we're really surprised when we go out to, say, a county commissioner, and their frame is a completely and totally different one. And so that's why this is really, really important. You have got to really understand who your audience is and what their frame is, their frame of reference, they're thinking about it, and we're going to talk a little bit more about that.
And we'll come back to this diagram a couple of times this afternoon. Framing your message, this is a quote from early journalists who really started thinking about how the media frames our reference on issues. And the quote's, "The way in which the world is imagined determines at any particular moment what men or women will do." I think sometimes it's easy to think about how something is framed in the media because it's out there. We know it influences the public. We know it influences decision makers. But in much the same way, each one of those circles, every person you're working with has a certain frame. And so we have to realize that and use that understanding to frame the messages for each of those individual groups.
You know, it's really interesting because there is a lot of great social science research that shows that what we tend to do as humans is read, consume media that reinforces our frame of reference. So if say there is an editorial and it states what we believe, we will read it, and if there's an editorial that is the opposite of what we believe, we tend to just dismiss it. So we tend to, these frames tend to be self-reinforcing as well.
So how do we kind of bust through that reinforcement that we all have? That's by asking some questions, getting to know our audience a little better. We need to know what people think. We need to know what we want them to do, what they believe, what they're doing now, what's keeping them from believing or doing what we want them to, and then what motivates them. So you get into the barriers and the benefits, and this idea of an exchange theory is that whenever you're talking to a group, let's say you have a policy issue, and somebody just doesn't think we need to have that policy. They don't really see any reason for it. Things are moving along just fine the way they are. You really have to do some work to understand why they think that, and then what would it take for that person to give up something in order to believe that this policy is necessary. And that's called an exchange theory. In regular marketing, it's easy. We pay for a soft drink, and we get the soft drink in return. in much the same way when we're working with these policy issues. People are having to give up something they believe in, so we have to give them something that they see as an equal or better exchange. A lot of times when it comes to elected officials, the exchange is that if they really want to believe in your policy and what you're doing, what you need to provide them is what is called political cover, that you'll be there to support them when something else comes down the road, or if they are taking heat on your issue, you'll be there to support them. So that's that exchange theory.
Reframing is very, very hard. Think about something that you feel pretty strongly about and think what it would take you to start feeling differently about it, which is why reframing has to be very intentional, very strategic, and you've got to know what their current frame is to begin to reframe it, if you will.
So let's break this down a little more. I think that you all received, when you received the information about the webinar, we sent out some questions that we hoped you were thinking about. And so one of those questions is, who is most important in moving your work forward right now? And that gives you some idea of where you are in this circle of influence. Is it your own leadership team or the coalition? Is it your elected officials? Maybe it's the city or county manager or state level regulators or electeds. Or very likely it's going to be some other category. But if you can start identifying who is just critical in moving your issue forward, you can start thinking about what their frames are and then how we can start framing this so people understand that.
Sometimes in this particular case, you need 4 votes on a city council, and you may have access to those 4 people, or you may not. I know with a lot of groups, when we talked at the conference, it was, okay, who does the city council or the county commission, who do they listen to? Who there could be a stakeholder that you could get involved that has influence over those folks? In many cases, and in this particular case, the general public is important, but sometimes it can actually increase the controversy. So you have to be very careful before you go broad immediately to make sure that it will actually help rather than increase what could be a controversial policy, if you will.
And I think I should note that we are laying this out as though this is a linear process,
Yeah.
and it's really not. We realize you're going to be working at many different layers on these circles. You may go broad at some point. You may have to focus in at other points. You can diagram this out, but I think being mindful and intentional about how this all plays together is really where the secret lies. And I see Vera juggle these things every day, and I don't think you ever write anything down necessarily in terms of who's on this diagram, but you just start thinking about this in different ways, and it will become more of a natural process.
That's probably a good way to do it, because there is nothing linear about it.
So the next part of breaking this down is what you want these individuals, these groups, to do. And this starts anywhere from understanding the issue to participating, to supporting, voting, testifying, talking about it with their neighbors, or actually maybe changing a business policy they have that is one step toward more of a more broad community policy. I think that many times this idea of understanding the issue, that's really not what I would consider an action, but sometimes that is where you have to start with people, especially the broader community, educating them about it, helping them understand what all of the elements are. That is important, but quickly be thinking about what it is you're asking them to do. Even if, like I said, it's just talk about it in the community or be an advocate for it. Education and understanding are important, but if you only focus on those things, you really never get to the actual actions that you're asking people to do.
Right, and we talk all the time about awareness to attitudes to action. And what's interesting is, I mean, you think about something that we've been, an issue we've been dealing with for a very, very long time in our worlds, right? So take like maybe a seatbelt. So for the longest time, let's face it, awareness was not even an issue. I mean, you know, how many of us who are old enough can remember when seatbelts were just either taken out of cars or just weren't used? And at some point, that awareness came onto the stage, and then attitudes needed to start changing. It wasn't that, you know, that these are necessary things. And then I still remember people just wore them on long trips. And so people needed to change the attitudes of you need to do them on, you know, whenever you get into a car. And eventually you've got to move people to action. And they all, again, it's not a linear process. They all tend to work together. But if you don't have awareness of the issue, you'll never get the attitude you want nor then the action that you need.
And the policy was really what nailed that one, though, to having ramifications of not following the policy. So the next piece of this we have to look at is what's keeping people from doing what we want. Seatbelts is the perfect case. But in the work that you're doing in your community, maybe it's that they don't have the same vision that you all do, that maybe you haven't even asked them to be a part of it, or they don't think we need a policy, or they fear losing something. In the food councils and in some of the work that you all are doing with the healthy foods and vending machines, maybe they fear losing a profit. They don't know how this will affect their own business. Maybe there's a budget consideration for the city or the county. So you have to really understand what those barriers are. And then at the same time, you have to be thinking, well, what's the benefit? Helping them understand what the benefits are. Maybe there are already your early adopters who get what the benefits are, and they can help you understand what that kind of message might be.
Actually, you know, and this is where storytelling comes right back into it, because the best way to reframe something is to, you've got to know what frame you're headed toward, but then to be able to tell the stories, and your early adopters will be able to tell the best stories that talk about the benefits. It is the most powerful thing you can do.
So with that, we take these three elements and we look at what we're asking people to do. We look at the belief systems they have and the benefits or barriers. And within that, we find the sweet spot, as Vera has said before, which is the message. It's a small target sometimes to get all of that to work based on who you're trying to reach. But that really is where you have to start, where you have to end up, or else it's going to go sideways and you're not going to see the traction and what you want to happen.
You know, and it's interesting, too, because I was just thinking about this. You know, you've got to make your case, and then you've got to listen, and then you've got to revise your case, and then you've got to listen, and then you've got to, you know, and it's that ongoing juggling that Tami talked about. And part of it is, and this is where having empathy, really being able to put yourself in whoever shoes you're talking to is incredibly helpful, because your message is one of, I don't know, 25 they've heard that day, 50 that they're dealing with. So some understanding of the various and sundry things that are competing for their attention, and then being able to put yours into a situation where these folks understand you know what's going on in their world. And I think that is a huge step.
We have a question about any special tips about how to reframe misperceptions. And I can just tell Vera has an answer for that question. So we're going to move on.
And actually, this is perfect, because this is where we get to the heart of it, okay? You go ahead, and then I'm going to give my answer.
Okay. Well, this next slide talks about message frames. So we have on the one column, how do we talk about this in the community with each of these groups? What we are looking at on the right side is, what does the audience believe? If they believe the issue is more about economic development than quality of life, then that frame better be an economic development one. If, on the other hand, they are worried about costs and they don't really care about quality of life, then that frame better be around costs. And then how you tell that story, really, if there's nothing else we share today, it's kind of this is the magic mix of what it takes to tell that story. It's using the data, but making it understandable. We'll come back to that. Anecdotes that show impact, using metaphors, visuals, putting that all in a context of, again, where people are at. That really is the sweet spot, as we've talked about.
So in getting ready for this, we looked at the Frameworks Institute, which we really, really like them because they do this with research, right? I will also tell you, I think sometimes it gets academic enough, it's hard to wade through. So one of the things that we found there, and one of their, I love this way they do research. They do what they call talk back. And so what they do is they give a person a frame, and then they see how much of that the person can then tell the next person. And what happens is, you'd be amazed apparently how many times we can't even take a simple concept and repeat it because we let our own frames get in the middle of that, right? Well, they've done a lot of research as to food. They call it food and fitness. Those were the words that they found worked really well. Now, fitness tends to be something that people think of in terms of exercise, but with a little bit of work, people got that fitness is just being active. One of the things that they found very helpful is to start the conversation by helping people get out of their current frame. And you all know what the current frames are. One of the biggest is it's personal responsibility. This is all just my own lack of either willpower, or I just need to not go to a fast food restaurant, or I'm just not making healthy choices. One of the things that they found was really successful is, first of all, and I think this makes some sense, and it kind of cracked me up that I hadn't kind of thought about it, bringing doctors into it. So they had a little phrase that was a version of, doctors say you can measure food and fitness environments, and by doing that, tell how healthy people will be in a community. And what that does is, using the food and fitness environment immediately gets people to thinking outside of the individual responsibility. Bringing the doctor in shows people that this is about health, and then saying that you can measure and then identify, kind of essentially give a rating, if you will, of how healthy each of us are in our, how healthy a community is, shows that there is a community aspect to this. We'll make sure that we get I know we have the link to the overall Frameworks Institute, but we'll make sure we get you a link to this particular paper. There was another paper on this that I thought got in the weeds a little too much, but this one paragraph alone may be worth exploring in your all's work, again, just to start conversations. It doesn't end it, because at the end you're going to have to get to economic development, you're going to have to get to quality of life, you're going to have to get to a healthy community. But this is a way to start getting them out of, and this is how they talk about it, small picture thinking, which is individualized, to big picture thinking, which is community. You don't want to use those words, but this is what helps start that reframing.
I think that a part of that, Vera talked about the words, I think that the other data part of this is the social math that can help demonstrate the real impact that your work is having on a broader part of the community. Just throwing data out there, just throwing numbers out there, we know it doesn't work. People's eyes glaze over. They remember things about it that you don't want them to remember. And I think that it takes a real effort to go back in and say, this is really what we're talking about here. I know in a meeting I was in just this morning, we were talking about, of all things, graduation rates. And it wasn't until one of the administrators in the room started breaking it down, talking about it individually by school and school district, and making it very personal, talking about families and kids, that people started to pick up on it, and you could see the whole demeanor in the group change. He was able to take that math, that data, and make it very, very real so people could understand it. And Otherwise, we would have been going through 3 pages of data, and nobody would really have picked up on what the meaning was. So I think you'll find this in your own work, but it's not as easy to do as you think it is, or maybe you don't think it is easy, but it is just, it takes a little extra effort to make this translate the work you're doing and making people understand it.
You know, one of the best social math examples I heard, and this was from years ago, and it was about our healthcare system, and they were talking about if you looked at our interstate highways in the same way as our healthcare system, then you would have a mile-long pothole every 9 miles. And I thought, what a great, what a great way to get people to understand something that was very difficult to explain, and then talk about how would we get anywhere, how would we deliver goods and services, how would we have the strong economy we would need if we literally could only go 9 miles and then we'd have a mile-long pothole. And it immediately gives you a picture in your head, and that is one of the best examples of social math, which is why I've remembered it all these years. I mean, that probably was now 15 years ago, and I've remembered it for 15 years.
The other, talking about frames and how to reframe issues, I know here in Sedgwick County, the Health and Wellness Group has been looking at food deserts and even reframing the idea that we have, that people don't have access to food. Instead of saying access to food, they've reframed that as food deserts, has really helped people understand what that is. We've heard it repeated back in meetings now several different times from people who otherwise really wouldn't have been paying attention to the issue. They got a front page article recently, and I think that the way they framed that helped break down some of those barriers. So moving on to talking about policy change, and 3 examples that we know you all are working on. These come from Mary and Natasha, and they are the content experts in these areas. We can help with messages. I think what's interesting about the way that these are laid out is that, for example, if you're working on a food policy council, you're probably going to be working with a specific group of people, and the vision statement, the goals, what their responsibilities are going to be really important. I've been working with a bike pedestrian advisory committee here in Wichita, and it's interesting. They've had their vision and their goals set, but it wasn't until they started meeting as a committee that they thought, what are our responsibilities? We're supposed to advise the city council, but what does that really mean, and how do we get our information? And so this is an ongoing process, but these are important questions that something like a council will need to be addressing. The healthy food and beverage policies, again, goals and purposes are important, but as you get into those broader circles, talking about nutrition standards, pricing requirements, product placement, use of promotional space, labeling, and local purchasing all become part of your messages. For comprehensive plan, active transportation, you're looking at goals and objectives of policies always, but then you look at mobility and transportation, land use, community design, existing conditions, and demographics. Again, those all become part of your messages beyond, as you get out into the community a little more and based on who you're talking to. So just to bring this home to the circles of influence slide, let's say we have healthy food and beverage. Your senior leadership team and people you're recruiting to be a part of your coalition, knowing the vision, the goals, and the responsibilities are going to be critical. As you go a little broader, key stakeholders may be food producers, so they're going to be interested in pricing requirements, nutrition standards, and then as you get into the broader community as a whole, again, this is where those campaign ideas start formulating. You're going to be having to explain who's involved, what are they doing, where are they meeting, when are they doing this, and the why and the how. So those are the broader messages that would have to be developed for something like that.
And again, many of those you would use, and we've got an example coming up here in terms of a fact sheet, but many of that would also be stories. So you know, fact sheets kind of give the basics, and then stories bring it to life.
So that brings us to our final two items, really, just to talk about tools. Fact sheets are very important. It doesn't really matter where you're at on that circle of influence. You're going to need a fact sheet or something that summarizes why this is important work and why people should be involved in it. Here are just some really clean tips on what makes a good fact sheet. This actually is at a place down there at the bottom. You can see the website. It's Connecticut Health Policy Group that has a lot of tools that are very well developed, very well thought out. Some of them are geared more toward individual advocacy, but I think in general they have a really good toolbox of materials. You can see here, I'm not going to read everything, but shorter is better, readability, bullet points. Don't assume that people have any background on any of this. You're going to have to make this very clear every single time why this is important. Leave white space, and don't forget to have that call to action. Even if it's just a call for more information or go to a website, that kind of connection is really important with any fact sheet.
I really look at a fact sheet as like your starting point, almost the Bible, if you will, for whatever we're doing, because once you get it down to one page, you can then use it in multiple ways. If you need to turn it into a guest editorial, or if you need to write a letter, you go to your fact sheet, which has the basic information and the basic messages the way you want them to be, and then that is what you can go from. And I will tell you, I am amazed at how many times people who have been working on something for a long time still need that basic fact sheet, because we all have so much in our heads these days. You just have to have one place where it's all written down. So now to do another. So we're all singing from the same book. I mean, really, it is incredibly important, and put some time into getting it very simple. And by the way, that try to get it more simple. There is some great research that shows that the more information and numbers we pile on, the less any of us remember. So really work hard to get only the basic facts and not the in-depth facts.
We have a question here about how do we know when we have the right message or story for a given audience. And I think that there are a couple of ways. I think that before we go much deeper into the fact sheet, because that's kind of a test too, one of the real clear ways, this takes a little while, so you won't know immediately, but one of the real clear ways you know that the message is getting through is when you hear it repeated back in the community from somebody who isn't necessarily involved in your efforts. That means they've heard it, they've understood it, and they're repeating it back. But you can also tell, I mean, almost immediately if your message isn't clicking with folks, they're either going to have a nonverbal cue they're giving you or a verbal cue that this isn't just making a whole lot of sense. Again, I kind of go back to this business and education group I just had an experience with this morning, and sometimes the business people and the education people are speaking two different languages, but you can immediately see whenever one of them makes a point that the other one gets, and it means that they've actually simplified that message down to the point where the other person can connect with it.
And when you discover, because those nonverbal cues are so important, and we've all been sitting in that meeting where you just realize that something that the other person has said has made us uncomfortable, or we're not quite sure we're with them. So keep that thought in your mind, but then ask the other person that maybe we've said something that's just made them uncomfortable. I watched Tami do this with facilitation, and it's very, very good. Do your own self-facilitation and say, how do you feel about what I'm saying? That's the listening part. Or so what's your immediate reaction to that? And I just love to know. And so it's really hard sometimes when we feel so strongly about something to step out of ourselves and just let them talk to us and not feel like we have to counter every single thing. Sometimes it's just about listening and saying, you've made me think a lot. Can we come back and talk about this later? Because you're going to be much more prepared than the second time you meet to be really able to understand how to revise that and bring it back to them.
And with that, we do have an example here of a fact sheet that I think really does provide a lot of the elements we've talked about. This comes from a group out of California. It's not the Connecticut group, but I thought it was a good visual representation. They ask the questions. They give bullet point answers. They show who is involved in the task force. They've outlined their goals there, but it's not just a list of things that you have to wade through. You can quickly review it and kind of get a sense of what's going on, which is how most people will be looking at your materials. So you may, be disappointed in that, but if they can just walk away with one or two key elements, that's a win.
One thought too, and this is interesting. I hadn't even thought about this, but usually for your fact sheets, don't let them interfere with your connection and building relationships. Either use them enough before that somebody has an idea, or if it's something that you want to frame with them first, go in and talk and then leave the fact sheet as a reinforcer, not as an introduction.
So the other tool we said we would touch on today is social media, and I picked 3 out there to talk about because, as I said earlier, we could make a whole workshop out of this, and Vera and I may not be the right people to even have that workshop because we use social media. We know it's an important tool, but I think we both realize that these are tools like any other tool, and it's easy to get focused on these more so than anything else because they are inexpensive and everyone can do it, but knowing when to use them and how to use them are very, very important. We've outlined just a few things to keep in mind. When you're using Facebook, this is a place where you can build community, where you can have interactions, increase awareness, post information, promote events, and use it as a tracking tool, a listening tool. But it doesn't take the place of those important in-person conversations as well. The other thing to keep in mind is somebody has to be paying attention to that conversation because it may be going on at 2 in the morning, or it may be, it would be easy to miss some important interaction if you don't have somebody paying attention to this all the time. Twitter is what I would consider a broadcast medium. You'll see the most successful people on Twitter are those who have a following already, who are entertaining, people like to listen to. The media is a big, they have a big presence on Twitter. They follow everyone because they always think it's going to be a lead on something. Politicians also have been using this effectively. Again, they see this as a platform. It can increase awareness about issues and events, and you can use the hashtags to track keywords. And retweeting is a big deal, but it's kind of a passive way to keep track of what's going on out there. I am an expert at retweeting because I don't have an audience. So unlike some of the entertainers out there who have hundreds of thousands of people who are interested in everything they say, I'm not in that category. But the retweeting part of it is good. It shows that you're reinforcing something you believe in, and it shares it then with a broader audience. Instagram is a visual medium. Of course, it's all about photos, and they can tell a story. A photo is worth 1,000 words in many cases, and it's a great promotion tool. So, but again, you have to have the right elements involved to make that an effective tool. What did you have?
Yeah, again, you've got to go back to your audience. These are tools just like a news release is, just like a fact sheet is, just like a brochure is, right? So with these tools, you have to understand your audience. I know politicians locally as well as statewide who utilize these tools, and I know others who absolutely have never been on Facebook and especially not on Twitter, right? So it really does, again, come down to which group are you working with? Is Facebook an effective way to reach key stakeholders in organizing? There's been a lot of great examples of that. I mean, that can really work, but your stakeholders have to already be on Facebook. the biggest hint here that everybody says is go where the people already are. You cannot start something on Facebook and then try to get people there. If they're already on Facebook, then you can likely engage them there. If they're already on Twitter, you can likely engage them there. If you're going to start from scratch and build a community on Twitter, your community may not be tweeting at all. So again, know where your audience is and then utilize those tools.
It's a reinforcing tool. These are all reinforcing tools in many ways that once you've got a group working in the community, these tools can be used to reinforce messages. But Vera's absolutely right. You can't build the community just using these tools. And policy issues are different category than political campaigns, which are very individual. You have individual relationships. With policy issues, many times you're trying to cast a wider net, and sometimes these tools are effective, and sometimes they're not. So with that, here's a list of resources that we've used in putting this together that we go back to in our own work time after time. The Frameworks Institute, Vera mentioned earlier, we will get you the article she, or the paper she referenced, the Connecticut Health Policy Toolbox, and then KU, the foundation was an early funder of something called the Community Toolbox, which I know we've talked about before. The other resource I'm going to just briefly reference, at our presentation in October, we went through the community change model, and we're not going to go through these again, but I just draw your attention to how to use this to start building your communications, to look at what your messages could start being built around. If you're looking at community mobilization and maybe shared goals, leveraging, coalition building, funding, those are places that people will be interested in knowing what those kind of messages are. So we've done this for each one of the circles on the community change model. It gives you the audience, where to start with your messages, and then the media. And I think with that, we'll see if there are any other questions. And sorry, I'm going to run through these because we're going to get through to some other slides. Any other questions or any questions about the work you're doing that we could maybe help you with?
And while we're waiting for questions to come in, there is one thing I was curious about. You mentioned just decreasing the controversy, say, before you go in. And I was curious if there are some examples or some strategies that you've seen people use particularly well in trying to do that.
In decreasing the controversy?
Mm-hmm.
Yeah, that is such a good question. You know, the best thing to do, I've found, is really understand where people are and how big the change is that you expect. I will tell you, I am always amazed at what I think should be pretty easy change that is really hard for people to get their arms around. And you know, I'll use an example, which, you know, think about bake sales, right? This is the time of year when many bake sales happen around the holidays. And people feel very strongly, much more strongly than you would think, about bake sales. So understanding the emotion behind that, I think, really helps then start the conversation at likely an earlier point than what we would want to do. If you immediately go to it's got to be healthy food at a bake sale, you're going to have a group of really, you're going to have controversy, right? It's going to all of a sudden potentially rise even to the, you know, to the local, you know, news outlet of here's who's trying to control what gets sold at bake sales to support the local blah, blah, blah. So really understanding the emotion behind it, and then I would say don't dive in the deep end. Just go a couple of inches in and see how, you know, see how accepting people are as opposed to starting where we might want to finish the conversation.
The other way I've seen that effectively diffused is simply by asking a question or saying something such as, help me understand that better. Help me understand why you think that. Sometimes when you ask a question, it helps diffuse the situation more so than any amount of making a statement or telling a story can do. So I think that I've seen that happen in meetings many, many times. So.
Yeah, and then one final thought, when Tami and I know that we're going to be running up against a group of people who are going to absolutely have the opposite viewpoint, it's important to use what you call blunting. You need to acknowledge that opinion, that feeling, what they're going to say, and then acknowledge it, and then move to your message. It can be very tricky to do. You have to be super careful, but it's another good way to diffuse some of that controversy. For instance, in the bake sale case, the whole idea of saying, we've been doing bake sales the same way for a lot of years, and we know that this is something that people feel very, very strongly about. We also know that we all care for our children's and our community's health, and so we're trying to figure out a way that honors both of those legacies and hope for the future.
I think that goes to shared goals.
Yeah.
I think sometimes that's a missed opportunity to really identify what, there's going to be something that you could share, you have shared goals on. So really finding out what those are helps diffuse what could be an otherwise negative approach.
Great. Thank you for that. At this point, we don't have any other questions that are coming in, but if folks have questions, feel free to type those in as we go along. But nothing has shown up as of yet. So at this point, if there are no other questions, what we'd like to do is to move to our resources point. And thank you so much, Tami and Vera. This has been a wealth of information. So very, very, very helpful.
Thank you, Shauna. We are glad to be with you all today.
Wonderful, wonderful. And at this point, I'd like to turn it over to Claudia. And again, as you have comments or questions, feel free to type those in as Claudia is going along.
Good afternoon, everyone. We continue to want to make these after the webinar sharing times as productive for you as possible. During this time last month, we shared a few new SharePoint resources and heard from several of you that you like that. So we are repeating that with an access to healthy foods and another related to active living resource today. We also still want to encourage sharing amongst the HCI teams, so please do type in a question or raise your hand if there's anything you'd like to ask or share with the other teams so that we can make sure that we have time for that today. And as Sean had mentioned too, if you have additional questions for either Tami or Vera, please do type those in or raise your hand as well. Next slide. Okay, the first resource that I want to share today is the resource, and it's the first one right now that is posted under featured resources on SharePoint. It's a new report from the Iowa Leopold Center for Sustainable Agriculture, and it's about the economic benefits of local foods. And maybe some of you are aware of that Leopold Center for Sustainable Agriculture. I know that some of the communities are referencing that particular resource. If you've set alerts on SharePoint, you may already know that there is that it's there, and that you've even thought about some uses for it. So if that's the case, please type in a question or raise your hand to share some of the thoughts that you've already had perhaps about that. Regarding the resource, across the country and here in Kansas, the production and distribution of local foods has been an important topic. Food policy councils and others are looking at regional food systems about how to advance local foods, and then beginning with creating some of the awareness about the economic and health benefits of local foods. With local foods, increased access to healthy food is an important consideration. That health benefit has some really great potential. Also, a reference on SharePoint is the CDC State Indicator Report on fruits and vegetables. And if you've had a chance to look at that, you know right here in Kansas that adolescents and adults alike have very poor intake of fruits and vegetables. Some of those statistics are given. Over 41% of Kansas adults report consuming fruits less than 1 time daily, and over 22% report consuming fruits less than 1 time, or vegetables 1 time daily. And for adolescents, the numbers are over 40% for those eating fruits less than 1 time daily, and for vegetables less than, or over 35% consuming vegetables less than 1 time daily. Now, if you take a look at some of the suggestions that Tami and Vera were given, which I thought were very, very helpful, you might recognize that perhaps the way that you're going to use these statistics is for your own use, and that the discussions that you might have in your community then would be around what Tami and Vera were referring to about the food and fitness environments, in talking about how the local foods might be able to solve some of the issues that different areas of your counties are having with food deserts in providing that access to healthy foods, fruits, and vegetables. So I think that you can gain some insight as to the benefits of local foods, and particularly fruits and vegetables, in talking with some of your audiences. The next slide. The next slide is the second resource that I'd like to share today, and it is also on SharePoint under Featured Resources. It is an article from Minneapolis that was shared with us by Mary Morrow, and it's titled Cities, Cars, Cycling, and Human Happiness. Again, if you're looking at reasons and statistics for addressing these kinds of needs to identify those benefits for changing those environments, you can look at the statistics on physical activity for youth and adults alike. It's not news for all of you that less than half of U.S. youth are meeting the recommendations for at least 60 minutes of daily physical activity. And when it comes to adults, less than 21% are getting recommended levels of physical activity according to CDC statistics. And then you also know that perhaps you've had an opportunity through different surveys within your counties, or by looking at the Robert Wood Johnson Foundation's Community Health Rankings data that is found also on SharePoint, that your physical activity statistics may be slightly better, or maybe even less good than some of those statistics too. This interesting article, and again, if you are on SharePoint alerts, maybe you're already aware of that, gives you another tool in your toolbox to help to educate, mobilize, and generate some advocacy by decision makers. And let me give you just a couple of examples of that. One idea is that you can perhaps use the information to create some interest for earned media. The article presents a slightly different angle for active living benefits, which maybe will hit the right chord with a reporter to generate some earned media about leadership team efforts in your counties to make active living easier. So again, the focus is on changing the environment and rather than personal responsibility. Well, this particular article does talk a lot about the automobile commute time in large urban areas. I think you can draw from this also for rural areas in that it does talk about how cyclists report feeling connected to the world around them and that their journeys are both central and kinesthetic. So it points out that the study referenced in the article found that more people walk each day, the greater their energy level and sense of self-esteem and self-happiness. So we've heard some of those reports before, but this is another interesting article that helps to point out and emphasize some of those benefits. Another idea for using the article might be to develop or enhance support by mental health professionals and organizations to advocate for your team's active living efforts. Mental health experts are well aware of the mental health benefits of physical activity, and children who take healthy meals and exercise often are often associated with better health and fewer academic and behavioral problems. So those are just a few of the reasons why mental health experts might really see some benefit to the active living efforts that are going on in your communities. So these are just a couple of ideas for using these resources. You know, I have to say that I'm constantly inspired by you and the creativity of your leadership teams, and really think that it would be helpful if you can share with others how you use these and other resources. So we encourage you to share today. We'd love to hear from you today about resources like these, or if you've had a chance to think about these, how you might use them with some of the other teams. Another way of sharing that information other than these after the webinar sharing times is to use the discussion board on SharePoint. So we'd really love for you to do that as well. I'm going to pause for just a minute before I go on to share a few more things on SharePoint to see if anyone has any comments about these resources or has had an opportunity to look at them and has thought about using them in different ways.
And so far, there are no questions or comments in our question box.
Okay, feel free to do that.
Just 1 second, there's one that just came in.
Okay.
Can you elaborate on how you might localize a pitch using the book?
And can you, and which book is that you're referring to?
Let's see, it's Charles Montgomery.
Is that regarding
cars, cycling, and human happiness?
Yeah, it's the article, Cities, Cars, Cycling, Human Happiness.
The slide you're on now, that one?
Yeah, that particular resource was an article that was posted in Minneapolis that Mary had shared with us. The recent book I have not read, so I can't give any additional information on that. Has anyone else read that book and have any thoughts about that?
I think the question really is that there's a resource out there, and how might we localize that that resource to our community? So that's the question.
So,
Any answers?
well, and this is Vera. We're happy to at least give a couple of thoughts. So one of the things is to take one or two things out of a national, or any resource that's not local, and then see, you obviously are paying attention and building those relationships with reporters locally. So understanding what they, reading them, what they tend to cover, what they like to cover, what kind of gets them going, and then being able to essentially, I mean, it can be done one of two different ways. Well, it can be done one of multiple ways. I like to sometimes call them up and just talk through, hey, I just ran across this, here's what they say, here's a, I think it's something that could be really interesting for your readers, your viewers, and oh, by the way, I'm pretty sure that so-and-so could be a great example of this. You're going to need to be able to have a, like in this case, a person who bicycles, who can talk about how they have experienced this, right? And then you might want to have another person. Essentially what you're doing is you're taking that idea and kind of creating a potential story out of it for them, and then sometimes I email it and sometimes I talk through it. It's kind of like anything else. The idea is to give them the germ of an idea, the start of an idea, maybe the start of some potential sources, and then let them think it's their idea.
Great. Good question. Okay.
Those are really good tips, Tami. Thank you for those tips. Are there any other questions?
No, that was all.
About using them. Okay. We'll go to the next slide. Okay, the next slide I think is of interest to everyone. We want to make everyone aware that we, especially Adrian, has really been working to make it easier to find things on SharePoint and to make sure that the resources there are something that are very helpful and usable for you. If you go on SharePoint, you've been familiar with it, you'll recognize that some folders have been deleted and some have been combined. One folder that should be of particular interest to you and your teams is contained in the folder All Resources. So if you click on the folder All Resources and then go to Policy Priorities, you will find in that folder 2 folders along with some additional resources below those folders. The first of those folders is called Active Living Kansas Resources, and these are particular to the kinds of recommendations and tips that have been given to Kansas. In this folder now you will find all of the memos that have been prepared by the Public Health Law Center specific to requests that different communities have had about situations regarding active living within their communities. We know that from discussions in different leadership team meetings that some of the memos may be of interest to teams, even if it's not their policy focus, because it's work that their broader coalition is doing. So we hope that you will find this information helpful. And then on the next slide, you will see that there is also a folder for Healthy Eating Kansas Resources. And in this folder now, again, are resources that you may find helpful that other teams have asked for or that are working with. The first one that you see listed there is the Parks and Recreation Exclusive Beverage Supplier RFP that Lawrence was able to put out. And then also other memos that have been created by the Public Health Law Center. So as we have more specific Kansas-related resources, we will be posting them. Adrian will be posting them in these folders. So I can't say often enough that we really want to make SharePoint something that is helpful for you. We don't want it to be something that is more time-consuming for you. We have talked in the past about setting up alerts, and if you're not doing that or not sure how to do that, Adrian's happy to walk you through that setup. And we'd also like to hear from teams who are using their community folders and what they have found especially helpful in posting in those particular folders, how it's increased communication or enabled communication amongst their team members or other things that they have found especially helpful. So those would be good topics too for the discussion board on SharePoint, and we encourage you to do that. So with that said, I'll conclude my discussion about SharePoints and open up the conversation for anything that you all would like to share with each other, questions that you would like to ask, other questions that you have of Tami and Vera, or questions about other resources.
Thank you so much, Claudia, for sharing those helpful resources and giving some guidance in terms of where people can find things further in terms of the memos that are being created from the different communities. Any other questions or comments for Claudia? Okay, we do have one. Are any other HCI communities besides Wichita using Twitter? So, and we'll wait a few moments to give folks a chance to kind of weigh in and see what kind of comments we get back for that question.
Is anybody aware of any other communities using Twitter?
Okay. Yes, yeah, well, yes, of course, KHF does use Twitter.
I think the Health and Wellness Coalition in Wichita is using Twitter through their FIT campaign.
This is Adrienne. I don't remember hearing that from when talking with the other community teams.
I think this is Claudia. I think that perhaps Douglas County is using that on occasion, but I'm not positive about that either. I know that they are blogging.
Okay, great. Oh, Thomas County also. We've got a comment in that Thomas County uses it as well. Oh. Okay.
If you want to raise your hand, if you want to speak to that, Megan, you can raise your hand.
Yeah, and I can unmute you. Let me find you here. Bear with me 1 second. Okay. All right. Let me.
Click on it.
Yeah. Let's see if you're nope. Trying to unmute you. I'm sorry, I'm not able to get you unmuted, Megan. But yeah, any other comments? Any other questions or comments? And feel free to also, we can continue this dialogue on SharePoint itself, but any other comments or questions that you have at this moment?
I hate to ask this question of Megan, but Megan has her hand raised, and we can't seem to unmute you for some reason. I don't know if it's a challenge with your phone or not. I don't know if you want to just type in kind of your experience with Twitter, how you've seen it, if it's been successful in your in Thomas County.
Well, it looks like we are not able to unmute or get that question in, so apologize for that, Megan. Any other comments or questions? Okay, well, looks like we have another one. Okay, all right, and it says, in our community, most of our population seems to use Facebook, so that is what we mainly use, but we still have a Twitter account. And we are just working on building our followers. So thanks for that comment, Megan. Any other comments or questions? Okay. Well, if not, I would like to thank you so much, Claudia, and thank you, Vera and Tami, for sharing those strategies and giving us so much good food for thought in terms of framing the message. And thank you all for joining us for our last webinar of 2013. And that will conclude our time today. And I'd just like to wish you all a happy holidays. And thank you so much. Bye-bye now.
Thank you. Bye.